The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us today for our webinar titled The Benefits of MIPS Reporting via the MIPScast Qualified Registry. Today's presenter is Kevin Perdue, Alterum's MIPScast Product Manager. Also in attendance and available for today's Q&A is Bruce Mackey, Alterum's Regulatory and Incentive Program Analyst. My name is Liz Jones, and I am today's moderator. Before we begin, I have a few housekeeping items to touch on. A PDF copy of today's slides can be downloaded right now from your GoToWebinar interface. We will be keeping everyone muted during today's presentation. If you have a question, please type it into the questions box in your GoToWebinar interface, and we will address it during the Q&A. Because of the large number of attendees for today's webinar, we may not have time to answer all of the questions. If we do not address yours during today's broadcast, you will receive an answer through email. Also, a link to the recording of this presentation will be available soon on the events page of our website at www.qppresourcecenter.org/events. Today, Kevin will give a live demonstration using MIPScast to enter MIPS performance data and show how it provides essential scoring feedback. He will also demonstrate how you can choose and compare the measures and activities that yield the highest scores. Additionally, Kevin will detail how clinicians and practices receiving free technical assistance through the QPP Resource Center for the Midwest can register to use MIPScast as a qualified registry for 2020 reporting, which means they can submit MIPS data directly to CMS at no cost. Following the presentation, and with any time remaining, we will answer any questions posed by the attendees. With that, I will turn things over to Kevin.
Thank you, Liz. Hello, everybody, and good afternoon or good morning, depending on which time zone you are in. As Liz said, I'm going to be presenting on MIPScast today, and that is going to include first going through a few slides and presenting some information, and then also going into a live demonstration and sort of a training focus. If you haven't seen MIPScast, it would be exploration of what is in the registry and how to navigate and use it, and we will just get going with that right now. Okay, so a qualified registry, for anyone who does not know, is a CMS-approved entity that collects clinical quality measure data from clinicians, groups, virtual groups, and submits it to CMS on their behalf. Registries are also able to provide additional services such as score comparisons, analytics, performance tracking over time, and other things. MIPScast is qualified to submit data for quality category. That's the MIPS CQMs, that is all of the MIPS CQMs we are able to submit for, and all of the eCQMs, which are the EHR-based quality measures. Also, the promoting interoperability. So for 2020, MIPScast is qualified to submit on all of the PI measures and the attestation statements. And also for 2020, in the improvement category, improvement activities category, that's all activities that are in the 2020 IA inventory. So this essentially allows you to do a complete submission to CMS for participation in the quality payment program. There are no measures that we do not submit that qualified registries are able to submit. Just to note that we do not and are not able to, as a qualified registry, submit Medicare Part B claims measures. Those are submitted through billing directly to Medicare. They calculate those measures, or the CMS web interface. That measure set is what is used by ACOs and also large groups. They have a distinct submission method that no registry is able to use and submit. Also, there are measures called QCDR, Qualified Clinical Data Registry measures, and those are specific to each QCDR. QCDR is like a qualified registry, similar to MIPScast, but they also develop their own measures, and those measures are the QCDR measures. They can only be submitted by that QCDR. And then there are also measures in the CAPS for MIPS survey data, which are also something that must be submitted through another method and not through qualified registries. So how does it work? For MIPScast, any active clinician or practice that is MIPS eligible or opt-in eligible can register to be QR participant at any time until the registration deadline, which for us, we set that as February 15th of 2021 for the 2020 performance year. So even after the end of 2020, you still have time if you have not decided yet to register for using MIPScast for submission. There's a registration process. I'll go over that in a little bit more detail. Then performance feedback is provided based on the data that is imported or can be manually entered into MIPScast. And that is available in the score prediction and analytics features. That's key because you want to be able to see how you're scoring and work on improvements throughout the year before that data gets finalized and is ready to be submitted. And there will also be direct feedback for anyone who is registered with us. Direct feedback that is reminders about deadlines, could be about incomplete performance category data, eligibility verification. So some of that feedback could be that perhaps someone only has 2 or 3 measures entered instead of the normal 6. That may be the case that you only have 2 or 3 measures enter. That's fine, but we're still going to look for opportunities to help you along the way to maximize your scores. Another key component is that there's the data validation and randomized audit. So all data goes through a set of validation rules by us before anything gets submitted to MIPScast, checking for things like numerators cannot be larger than denominators, measure calculations are done correctly. However, the randomized audit is a distinct process that is required of all qualified registries and QCDRs, where we select a random sample of participants and we request some detailed information, patient level, to verify that the information that you've entered into MIPScast is true, accurate, and complete. This does not necessarily make it so that you are not could not be later audited by CMS. That they have their own distinct audit process, and that could still happen even after someone goes through our randomized audit. This is essentially a check on not only clinicians and groups, but also that the registries are doing things correctly. As always, we recommend following the published measure specifications and the data validation criteria that is available from CMS. So if you have registered by signing the consent form, then you will be contacted if there are any questions or issues with the registration. Sometimes we see things like an invalid TIN or an MPI entered, or if you're not MIPS eligible or not opt-in eligible but still sign the form, we're going to reach out because we wouldn't be able to submit for you. If you happen to fill out 2 of them, anything like that, we're going to reach out. After the agreements are fully executed, you'll receive an email, and that will confirm your registration and provide initial feedback. If you've already been using MIPScast and have data entered, we'll take a look at it right then and begin giving some feedback along with that confirmation of your registration. If you've not entered any data, then we will provide some instructions to get started with importing or entering data. As always, if you need help with MIPS program rules and reporting requirements, which can be very complex at sometimes, please contact the QPP Resource Center, and that will connect you with a QPP advisor if you are a QPP Resource Center member. Next, I just want to go over some important dates. So we are obviously in the performance year. We have the dates here that you can register to use MIPScast for submission, ending on February 25th, 2021. The feedback will be sent anytime between earlier in the year up through the actual submission deadline. So if you are signed in early February and get your data entered in March, we'll do our best to review that and get you feedback. But this kind of goes to an important point that the earlier you get your data in, the more opportunity you'll have to get feedback and make any corrections or optimize your score. Other dates in here are deadlines for CMS about the hardship exception application, which is open currently and ends on December 31st. Coming up, we are already past the October 3rd. Last day to start a 90-day performance period for promoting interoperability improvement activities categories. The performance year ends, of course, December 31st. Eligibility is going to be finalized in December 2020. And then the submission window opens up on January 4th and ends on March 31st of next year. So that's when we would actually do the data submission. We don't do it immediately on January 4th. We're still collecting data from people, but be sure to have it all entered as early as possible. Okay, I'm going to go into demonstration now. And I'm going to start on the QPP Resource Center website, because this is where a lot of you are going to be coming in from. So if you remember, you're familiar, you've seen this screen, this website, and I'm on the dashboard right now. See your information, resources, and all the great information, ability to connect with an advisor through this. And this is also where you get your access into MIPScast. So either from the menu up under name, you can click MIPScast, or from a link over here, you can click and launch into MIPScast. So I am already logged in, so I'm going to just flip over to this tab here, and now we're in MIPScast. I happen to be logged in with a user that is in a different system, because it's where I had this demo data already entered up. It's going to look the same except for a couple things. Start off here, you're on the welcome page. You see information about MIPScast as a qualified registry, and right here we have a link directly to the qualified registry participation guide for 2020. That is actually a longer version of the few slides that I just went through. So if you get into MIPScast and click on that, you will get to the participation guide, which has more details than what I just went over in those few slides. And then over here on the right are links to the data release consent form and business associate agreement. These links are specific to your user login. So as I'm logged in on a system that is a little bit different than what you would be seeing through the QPP Resource Center. It will say QPP serves, I believe is what it says, and a link in that. So this is a pretty simple process. You click on these links and it goes off to DocuSign, which is a secure system where you would enter in the information and sign and complete that, and it is fully automated. It goes comes back to Altarum, and it will get reviewed and countersigned if everything is good, and then that would trigger the process where we begin to send confirmation on that registration and the feedback. Okay, so what is in MIPScast? It's a pretty simple system designed that way to make it easy to navigate and easy to enter information. MIPS as a program is complicated enough, so try to take care of all the complexity and handle that in the application and make it user-friendly as we possibly can. Though at the top, we've got a menu for my organization, organizations, practices, clinicians, and I'll show you real quick what's in here. there isn't really any action to do in here. It just provides a list of in this case, the clinicians that are at this practice that are at this organization. So this is all demonstration data here I've got entered in. On all screens where you see a blue filter by bar, this is really handy if you were with a bigger organization and you were looking for anything specific. You could search and filter on that. But in this case, we just have 2 clinicians at one practice for demonstration purposes. And similar on the practices and organization tab. Here we just have the one practice under the organization. Next, there's the quality measure menu. This is where measures are added manually. We also have an option to view all measures that have already been entered. The ability to import measures from a structured data files, and also measure definitions. So I'll come back to those in a little bit here. Next, we've got score predictions. Score predictions has the ability to create a new score or to view historical scores. And all of these under quality measures and score predictions are specific to your user. So if you are, like most folks coming in from the QPP Resource Center, you're going to have your one organization, the one practice, and 1 to up to 15 clinicians for small practices in the QPP Resource Center. That's all you'll see, and you will only see your own measures. And then also we've got some analytics features under this report menu. I'll show that in a little bit here too. Off to the far right, we also have by the username and this gear, the about, which takes you back to the like about and login page for MIPScast, the documentation page, change password if you ever need to do that or want to, and log out. Before I leave here, I'll show you the documentation page. This is a pretty important place to know that it's there and to reference. We've got training documentation. So this is also where we keep the archive of the link I showed you earlier that goes to the participation guide for 2020. Also the MIPScast user guide. This is the comprehensive user training guide. It has a lot of what I'm going to be showing today in there, and how to navigate the system and enter data. So that's, both of these are really important to have copies of, especially if you're going to be using MIPScast as a qualified registry to actually submit your data to CMS. Also, we've got recent release notes. We don't show all of the old ones because things have changed to the point where it wouldn't really be helpful to see old release notes when the screens have changed or anything, functionality, new features are added. So just the recent release notes and quick notes about those, you can check it out. So if you're an ongoing user and check here and you see there's a new release, you can see specifically what has changed kind of in the snapshot since the last release. Clicking on the MIPScast button always takes you back to the welcome page. Okay, so I am going to show you, first I'll show you measure definitions real quick. This is where you can see and link to all of the measure specifications. And while I made a note earlier about claims and web interface being measures that we cannot submit to CMS on your behalf because they must be submitted through other methods, we still provide the opportunity for people to enter claims data in to see how they're going to score. So that can be really handy. If you're going to be using some claims measures, the actual submission to CMS happens through Medicare billing. However, if you know your numerators and denominators for those measures, you can enter them into MIPScast. We will score them against the benchmarks and provide you feedback on what your score would be on those measures. So that's why we also have the measure specifications in here for that. Okay, so I'm going to start off with showing importing measures. Now, this is going to be something that only people with an EHR are going to be able to do because it requires a QRDA3 file. We do actually support some other file types, but those are really not in existence anymore, particularly the CMS submission XML files. Still have the ability to do that, but they're not not out, being used in practice. The QRDA3 is the standard that EHRs are using, and I will show you how that works. Okay, so I have got a file here ready to go. Grab it from the Choose File dialog, hit Import Measure Data. And what it does is, as it parses through this very lengthy file, we pull out some information. Now, I opened it up and edited it to have this fake tin. So to show you how it works, your tax ID number, if it's a group submission, or tax ID and individual clinician MPI, if it's individual level report, would be in that file. We automatically look for that and pull in here to the practice or clinician selection based on that match that we have in our system. If it was a clinician level, well, it doesn't match because there's no NPI in this particular file I'm using. It's a group level, but you could pick here. If for any reason the QRDA3 file did not have your correct TIN or just didn't have it at all, we still would give you the opportunity to select your practice name from this box right here. Okay, so it also pulls in the start date, the end date for the quality, same for the promoting interoperability category, and improvement activities. And also recognizes that these, of course, coming through a QRDA3, reporting from the certified EHR, that these are in the ECQM collection type. Clicking continue. And there we go. We've got all this data that was in the file. It has a summary here at the top. The number of quality measures, there were 11, happened to be more than required number of IA measures, and 7 PI measure entries. You can see right here, looking through those, what was in the file. Okay, so next you would say save. Now that actually commits it to the database. And again, we've got a summary of what was just happened, that 11 quality measures, 7 PI measures, and 7 IA measure entries were saved, and we're done with that part. Next, I want to show you the reported measures. So this is a history of what was imported before. So we've got the January 1st through October 31st, which was from the QRDA3 file that we just imported, a number of measures. There are some older measures that I put in here, specifically to show you something on the analytics report a little bit later in this demonstration. But everything from here to here is what we just imported. This is a good step to take to look and see what, just confirm that what you thought was imported was actually imported. On the screen, you have the ability to view. So this would open up the measure that was imported, and no, it's a read only, just to view it. Cancel that, come back. We've got the edit. Now the edit is not typically going to be used, especially for an ECQM, because the data was calculated by the EHR and directly pulled in here to MIPScast. I just want to point out that what you can never edit is the dates, the practice level, the collection type, things like that, or the actual measure, because that would kind of create a disturbance down the road if we allowed that. You couldn't take this data and suddenly change the measure that it applies to. The way to handle a mistake would be to delete the measure and then go back and re-enter it. That would be particularly the case if you're doing full manual entry versus importing from a QRDA3 file. Even changing the collection type, the ECQM versus MIPScQM, they are distinct specifications, so it's not a one-to-one. What counts in a numerator denominator on one collection type may not actually match one-to-one to what is in the other collection type. I'll cancel that. I'm not going to make any changes. And the ability to delete. Now, once a measure is saved to a score prediction, which you'll see in a little bit, this will become grayed out, meaning that it's tied to a a measurement set that could potentially be submitted to CMS, or just for your own purposes of doing score predictions. The way to delete a measure in that case would be first delete the score prediction, and then you could come and delete this. Otherwise, you'd be taking something out that is really dependency in a later step. Okay. Also, this is a good screen to show that there are some quick buttons here versus going back up. If you want to add another measure, you can do this. You can also just click on this plus. That would allow it to take you to the add measure. And then anywhere we see this kind of grid table icon, and if you hover over it, you see it says export reported measures. That will produce a CSV file, spreadsheet file that you can download and do anything that you like with it, of course, at that point. Could be good for doing some internal reporting. So we provide the data back to you, and this is available on many screens. Okay, next I will go into a score prediction because we've got all of these quality measures entered here. So to begin with, I'll show you that there is nothing here for this demonstration. I'll use the quick button to add a score prediction. Okay, you can create it at the clinician or practice level. We know that we just imported data for at the practice level, so we're gonna click that and pick the one practice that's tied to this user. APM is alternative payment model. We're going to say none in this case. However, we provide a list of the 2020 APMs that that you may be a member of or be participating in. And if you did choose one of those, what would happen is that MIPScast would shift to apply potentially a different set of scoring rules, in particular the APM scoring standard, which does a little bit different thing in terms of category weighting and what is required to report as far as categories. So we're gonna pick none for this demo. Certified EHR technology year. So for 2020, the only option is 2015 cert. If you did not have an EHR and you weren't reporting PI, you could just click no cert, and that would do an automatic reweighting in MIPScast. It doesn't actually officially do a reweighting CMS. That would be something you have to apply for. But this just sets up the rules for how MIPScast will handle doing score predictions. We're also going to check the small practice, which is impacts some scoring rules and bonuses for small practice designated clinicians and groups. Okay, and we'll hit this arrow here to launch this. Okay, so right now we've got the quality category with no data, promoting interoperability, same thing, IA, costs, and then the last one is this predicted score. There's nothing here. We haven't done this one of the first steps, which is if you've entered quality measures, come in and grab the date range that we just imported through the QRDA3 file, hit this button right here, and it is going to pull all that data from the QRDA3 file here in, and I can click on this and expand it, show some detailed information. Selecting the radio button here actually says this is the measurement set that I want, and what we've got next is a populated these scores for the quality category. We've got the decile points, which come up to 40.84, bonus points 16, pretty impressive in terms of bonus points there, and the total points for the category. There's also this option here about specialty sets. If you picked a specialty set, what it would do is it would score, it would take any of these measures that were imported, and there are 11 here, that exist in a specialty set, and then only do the scoring based on those measures that are a part of that specialty set. We're not going to use that right now. We're just going to focus on kind of this all measures of all 11. And the way it works is the top 6 measures ranked by the decile, or what's sometimes called achievement points, here is how they're sorted with an outcome or a high priority measure listed at at the top also happens to be the highest decile. There are no bonus points earned for the first high priority or outcome measure reported. However, subsequent ones can and do earn in this case. We also have the bonus here for electronically reported. All EHR or ECQM measures automatically receive the electronic submission bonus. That is, there's no way to not earn the electronic bonus if you're reporting ECQMs. These do have a cap, so while we have 11 measures, there are not 11 bonus points earned specifically for the end-to-end electronic reporting. It's capped at 6 or even fewer in the case that you had a scenario where there were only fewer than 6 measures, let's say in a specialty set, then if there were only 5 measures, then it would be capped at 5 bonus points, even if there's some other measures available. So, all right, let me click on one of these to show a little bit. Now it may not be evident just by looking at it, but if you click on a line here, it pulls up a detailed pop-up that has even more details about the measure. It has the performance score calculation and the data completeness calculation shown here. This is a single strata or single performance rate measure. So it's pretty basic. Performance met, not met, eligible population, exclusion, etc. We'll note that when we submit data, we submit it with the titles of performance met, performance not met, and eligible population versus numerator, denominator, which you may see on reports from an EHR, for example. The terms are somewhat interchangeable, but we've shifted to the performance met just for consistency, because that way the EHR and the MIPS CQM measures can be understood in the context of performance met and not met language. Now for ECQMs, performance not met is not something that you enter in, but it's something we automatically calculate. It is essentially the difference between the eligible population or initial denominator minus performance met and the exclusion. So that's kind of the what's left after those are subtracted from the initial population. ECQMs are always 100% data completeness because the EHR is doing the calculations and the reporting. So it's an assumed, no way around it, always 100% data complete in terms of what gets reported to CMS. But for MIPS CQMs or the registry measures, you actually have to calculate and enter in performance not met. And that's important in terms of meeting data completeness and affects performance score. Because ultimately the calculation, even though there are different representations, it is performance met divided by the performance met plus the performance not met for any type of ECQM or MIPS CQM that you enter, using the performance not met derived from what I just talked about in the calculation. The performance rate is uses the performance numerator and performance denominator. So in this case, it matches because it's a single performance rate measure. The performance denominator is different than eligible population because we have 10 exclusions that are subtracted out. So in the actual calculation, those are removed. Come up with the performance rate here. We also determine based on the data entered if minimum cases have been met. So it's 20 at this point in time, in the year 2020. And this looks at the eligible population. And then data completeness, which is different than the performance rate calculation, because this is all data where something has been reported. So we've got the performance met, performance not met, and the exclusions. All those count as something you reported for someone who existed in this eligible population. So as 100% data complete, of course, this, and this are equal to 100. So there we go. We've got 100% data completeness on this measure. Next to show is the achievement points or decile points calculation. We take the performance rate and map that down into where it fits in the against the benchmarks, and perform a calculation of that. It comes out to 7.58. 0.58 are what we call partial points. So it's because the performance rate is somewhere in between these two deciles here. Okay, so that's what's in the detail pop-up. I'll show one other real quick. It is a multi-performance rate measure. So here we've got two different strata. This measure is looking for strata. One is for outpatient encounters, the other is for hospital discharges. And so it's a measure of performance based on these two distinct subpopulations of the measure. And this is a good example to see how what was entered in gets summarized into a performance numerator and a performance denominator based on a specific performance algorithm, which in this case it's called the weighted average. So it essentially tallies, sums them up and then divides by the number of strata. And here we've got the performance right here, and it maps down to decile 3. All of this scoring mimics the behavior on the CMS submission site if you reported measures. So if it did not meet data completeness or minimum cases, the score would reflect that. So typically that would be something like 3 points for small practices. Okay, next I will jump over to the PI category. We had some PI data in that file, similar functionality. Find the date range with the measures that you want, import it in. Now, this does not have any points being calculated. It shows the performance points and bonus points, but you would not earn any points even in a submission to CMS just like this, because a few things are missing. One is the measure did not have this measure listed in that QRDA3 file. It is going to be an exclusion. So let's pick an exclusion for that. That satisfies one of these required measures. And as soon as we did that, we got the total points score here. I should also note here that if you click on these badges, they have more information about how they're calculated, total points. Same on the quality. If you click on decile points, it has a lot of information about the methodology for calculating decile points, how the bonus points are earned. So those are useful. You click on those, you get some more information. Improvement activities, I will do the same. Pull this in. All right, had some improvement activities, and those got pulled in here. It's more than enough to meet 100%. You only need 40 points. It's a small practice, so there's some helpful advantageous scoring there for small practices or rural health or non-patient facing, any of those special statuses. And over here on predicted score, and I'm going to just, for the sake of time, I'm going to skip over cost. It's here, but I'll just say that that registries do not submit costs. In fact, clinicians and groups themselves do not directly submit this to CMS to CMS. That's handled through their claims data that they determine eligibility for or applicability of any of the cost measures. So over here on the predicted score, got a showing the quality category score, PI category score, IA, et cetera. So if this was up to, if you're going to be, if cost was going to apply to you, then one way to kind of look at this is if you had 100% in everything else and this still wasn't 100, then that would essentially be perfect from what you submit, and then everything else would be filled in later by CMS, unless you had a hardship application that was approved to reweight cost category. We provide the opportunity to name the score here, so you could call it 2020 Q3 snapshot. And if you have everything entered in here, you can click score complete, score prediction complete. That just is a signal that you're not waiting for more information to enter. You can hit save. And there we go, we've saved this. This can be revisited again at any time, and it will have that in there. There's a download report option here, and this will provide a PDF of that. So it has all the same information that just kind of went over in the app, but this can be shared easily with someone who doesn't have a login in practice or elsewhere. Okay. Now back to MIPScast here. Let me go back and show what would look like if we were going to add a measure manually. Let's say you wanted to report a measure from the MIPS CQM because it's something that you do really consistently. I'll pick a measure here that I had lined up. It's not an ECQM, so no EHR is able to report as an ECQM this particular measure, advanced care plan. However, you can still report it along with the ECQMs. So for this example, I will just say 210 performance met, that there were 0 not met because you do it with all your patients all the time, and the denominator of 300. Now, this is a good place to point out that this yields performance score of 100%. However, it's just on the edge of not meeting data completeness. So you want to be sure that you report even performance not mets, everything you can on your patients that exist in the eligible population or denominator to get above this 70% data completeness. Now save this. Now go back to the score prediction. Go to edit. And oops, I made one mistake, but there's a good way to show. I'm going to leave this, edit this measure. Well, actually, I'm not going to be able to edit the dates, so I'll just re-enter it really quick. It'll only take me a second here. Practice. Change the date so it comes up in that same measurement set. 1031. It's MIPS CQM, measure 47. 210, 0, 300. That all looks good. Save it. Now go back to score prediction, edit, and now we see that another collection type of measures have entered in here. We still have the ECQM that would yield 56.84 points, the MIPS CQM by itself with 16. But if we do this combination, we're going to max out everything we can get in the quality category because you provide advanced care plans for all of your patients, or you have documentation rather that they have one, or in this case of this measure that they do not want to have one, they can still be counted as performance met. And this is worth all 10 points. It gets a high priority bonus. So it boosts your score. And we can submit this as a combination of ECQMs and this one MIPS CQM manually calculated, manually entered, and it shows up in your top 6 and boosts the score even more. So that's something that a lot of people may want to do. It would be very helpful. So as we're moving along here, time-wise, I will just show real quick a useful tool that we provide in MIPScast. It's under reports, is the analytic features. I'll go back to practice level, select the practice. I won't change anything else in here, and just hit run. And what we've got is those earlier historic measures that I seeded into the database. So you could see that in this case, this was a snapshot at March 31st, June 30th, and then these measures we just imported today. So that is useful. Once you begin to use MIPScast for a while and you have a lot of data entered, it can show a lot in terms of kind of visual progress over time, something to play around with or use as a part of your quality improvement strategy to track things. You hover over it, highlights a specific measure. You can also turn some off so it's less busy on the screen, focus on just a couple measures. So that's a useful tool, and it shows everything that's all the data below that is being used for the visual. This can also be generated into a PDF report and shared. Next is the MIPS score prediction analytics. I'll pick practice again, 2020 and run this. Now this is based on the score prediction, so this is kind of the overall, and it shows your rank compared to other clinicians that we have score predictions in for this particular year. So the rank, scores, and once you have a number of score predictions, the same thing would apply where you can see performance tracking over time up here, then detailed information about each by hovering over it, see where you're at. So that is the essential core functionality of MIPScast and how to use it, how to enter data. And I am going to switch back now over to the presentation slides. And next up, we've got a poll question.
Thank you, everyone. If you would just take a moment and let Kevin know how he has done today. This is something CMS requires of us to kind of monitor our progress. It's part of the funding that brings us to you and really brings this whole program that is free for all the small practices out there as well. We will leave this open for just a few more seconds. Thank you for everyone else that has already rated. All right, let's go ahead and close that one out. Thank you all for giving us that feedback. We just passed that right along to CMS.
Okay, thanks, Bruce. Okay, looks like we've got about 13 minutes left, and I'd like to open up to any questions. And thank you all for attending.
We've had a number of questions that have come in throughout the presentation that I've answered directly as Kevin was presenting. But if there's any additional questions that anyone might have, please let Kevin know. I'm going to type them into your GoToWebinar interface. We will address any questions in the time remaining. And thank you for those that have already submitted questions. Hopefully the answers I've given are adequate. Kevin, if you want to look in the questions box, if there's anything there that's come in that you want to expand on any answers, feel free.
Yep, I'm trying to, yeah, here we go. Trying to expand it in that little window here. It's seems to be only showing me
I think a bot was spamming us as well. I was trying to delete all of the nonsense comments and questions that were coming in. I don't know if those are still showing on your end. No additional questions have come in. Certainly feel free as you begin using the tool and create your account and start uploading data. If there's any questions at all, if there's anything that we can help with, not only in MIPScast, but really the quality payment program in general, do not hesitate to reach out to us. We have a great team of individuals across the entire Midwest that are ready and waiting to help you with this program. We know it's very confusing. There's a lot of details, but we've got this kind of locked down. So we'd be happy to help you with in any way, shape, or form that we can. Kevin, we just had one question come in. It says, if I have an EMR and can get a dashboard report, but cannot get a QRDA3 file, can I still enter numbers from that?
Yes, you can. It's the certified EHR technology itself that collects the data and then performs all of the calculations. That is all done electronically. That data can be transferred in by manually entering it in. This does happen quite kind of often, in the sense that a lot of vendors we've seen historically struggled to produce a valid QRDA3 file with things like having old measure identifiers from previous years still in them being generated, and we cannot import from that because it wouldn't map to the right measure, even though the measure was. So it's really about the report that they're creating isn't accurate, not that the numbers are not accurate. So yes, those can be entered in manually and still reported and still get the end-to-end electronic bonus.
Great. We just had another question come in about data aggregation or file aggregation. Can you speak to what MIPScast can, how MIPScast can help there?
Yes. So there are just some. We are able to do some data aggregation in a few different ways. One, if you had, similar to the question right before, you had two different EHRs that were being used and had dashboard reports, you could aggregate those outside of MIPScast on your own and then enter them in manually into MIPScast. So that would be a way to get them combined and into the format that needs to be submitted to CMS. Another is if you had two QRDA3 files, we have some specific rules where we can do aggregation based on that. It has to be for the same measures, the same clinician, same dates, things like that. So there's some specific parameters where that is something we can handle. So if anyone needs that, the best thing would be to come to us with their exact scenario, and we could review it and give a go or no go on whether or not those files would be able to be aggregated based both on technical conditions in the file as well as policy and what we're allowed to do.
Great, thanks, Kevin. No additional questions, and we can give it just a few more seconds. And like I said, if you have any questions that you think of after we end the broadcast, feel free to reach out to us. Okay, seeing nothing else come in, I think we are safe to wrap up for the day. Thank you all for joining us today, and thank you, Kevin. That was a great overview of the program. Hopefully you've all learned something and are eager to start getting your data into MIPScast. Again, if we can help you in any way, shape, or form in this program, not just with MIPScast, but questions in general, don't hesitate to reach out to us. You can reach us through, we've got a few different avenues there on your screen right now, but log into the QPP Resource Center, and that gives you access to our entire team that really spans the entire Midwest. We've got partners across 7 states that are working with us on this program as well. So reach out to us. We'll put you in touch with the people that know the answers, and we'll get you through the reporting for 2020. With that, thank you all very much, and again, thanks, Kevin, and hope to see you all soon.
Yes, thank you. Have a great day, everybody.